I want to tell you my story about design in healthcare. I work for a large hospital system in Toronto, Canada, and like most of you, we're challenged with many drivers for change. Over the last 8 years, I've been using design in healthcare to help build better futures with patients and families. But I can't help but think, is there more we can do with design? And so, this story gets a little more interesting about 2 years ago. I had an idea. We have an innovation fund in our hospital, and what I did was I put in a proposal to build my own design lab. And what happened was I got rejected. My CEO reached out to me afterwards and said, you know what, Sean, we want to build this anyways, but we want you to use your own operating dollars to do it. All of a sudden, I took a step back and said, wait, is that the best way to do this? At the same time, I was doing my Master of Design in Strategic Foresight and Innovation at OCAD University in Toronto, and I had to pick a thesis topic. So what I decided to do was to study design labs as a model for healthcare innovation and try to pick up on measures for success or effectiveness. And you may be wondering what design labs are. Embedded design labs are temporal entities within organizations that utilize design knowledge and capacity to enhance innovation processes. And that's from Jonathan Rahm, who's doing his PhD in this area. That allowed me to frame what I was talking about. And what I did then is I actually tried to identify labs around the world that was doing this work. And what I found were 32 different design labs in healthcare, doing amazing things in Australia, New Zealand, North America, and Europe. But then I had an even bigger problem. I had all this data, and how can I figure out and make any sense with it? So I drilled down into 17 hospitals and healthcare systems that had design labs and tried to measure effectiveness. That also became a problem, because how do you define effectiveness? And so what I did then was I took the examples I was hearing around where labs were having success, and I stratified them and put them into different design domains to better understand the innovations they were creating, the impact they were achieving, and the structures they had in place. And so the domains I'll go through right now. In the domain of traditional design, visual and graphic design, virtually all labs I talked to said they were doing work here. Things like wayfinding, brochures, patient education material. They were co-created with patients and families, and they looked pretty cool, and they were doing some great things. Most labs said they wanted to do more than that. In the next design domain, product and service design, people talked about amazing spaces and places. They talked about services and experiences they were creating. They talked about tools, apps, products, tactical innovations that they were able to achieve success in. But again, labs were saying, I think we can do a little more. The third layer gets a little more complex, and that's the layer of organizational transformation. Labs talked about how they were playing a role in things like enterprise-wide IT solutions, electronic health records, large-scale clinical innovations that had to move across big systems. Really, the complexity and the number of people involved with the work meant that there was less people doing this work, and it tended to be more of the bigger labs. The final layer was actually the rarest. And when we're talking about transformation all week, we're talking about systems transformation. And these labs, there was only a handful, but they focused more along the lines of virtual hospitals, hospitals in the home. How do we fundamentally change the work we're doing? And these labs were playing a role in their organizations in help achieving those changes. But many of you may have heard, obstacles and barriers exist in all of our organizations. Risk aversion, silos, time, money, deference to authority, randomized controlled trial as the gold standard for evidence, reliance on past data. All of these things were barriers to innovation that were limiting the work of the labs. And what became extremely clear to me was the organizational strategy is extremely important. Organizations that are able to understand their strategy, set a risk tolerance for their work, define an innovation ambition that they want to achieve, can then talk about what kinds of design they want to do and how they structure it. Structure, extremely important. There was 3 different models I found in terms of how these labs were structured. The first I called the lab in orbit. This is where the lab appeared to be outside the organization itself. They tended to be more of idea factories with very little ability to move their innovations and scale them within the organization they exist in. Doing great work, but not getting to transformation. The second was lab on the edge, and this was actually one of the ones that I saw the most. I would call this the space of tactical innovation. These labs talked about products, services, and tools, things that they're able to work with departments and programs and actually scale innovations within their organizations and start to think about business models to move them outside their organization. The last one, though, was the one that appeared to be doing systems transformation and actually moving things forward. And this is where the lab was at the heart of the organization. Innovation functioned with a straight line to the CEO within the strategy arm of the organization and had the resources to put in place to move their innovations forward. So where do we go from here? We've been talking about transformation all week. And I think when organizations talk about using design and looking at organizational transformation and systems transformation, they really need to think about what problem they're trying to solve, critically assess what they're trying to do, and then make sure the lab is appropriately structured to do it. Are they in the healthcare innovation business, or are they in the healthcare business? And these things become really important when you're trying to consider how you make your design lab effective. This was a quote from one of the interviewees. And I swear I put this in place before Mayo had this conference, because it sounds exactly like what we talked about. The future of health. The main goal of the patient's not to be in the hospital in the first place. Healthy people, not just curing unhealthy people. And so design can play a role in creating a better future together. We can design with patients and families and co-create a future. But without looking at the structure and the strategy within which the design lab sits in an organization, I almost think it's unfair to measure effectiveness with these labs, because it really is the organization that has to take on the innovation ambition and has to want to change. So the equation I've set for transformation is really that your strategy plus the risk tolerance you put in place will equal the outcome you achieve. And something that I heard tweaked me, because there seems to be a disconnect between what organizations are saying and what labs are doing. And designers want to transform health, but many organizations are asking their designers to make better posters and PowerPoint presentations. And we have to unpack why is that, and what do we actually want to do? Are we in the health innovation business when we actually want to transform health? I think that's a question we need to answer as hospitals and healthcare systems. So I want to thank my research team. These amazing people helped me along the way. Many of you might know Josina Vink from Mayo, and thank you for listening to me today.
Thank you, Sean.
Yeah.
You know, I think about design when I'm driving, and there are sometimes you're going down a road and you're at an intersection and the light doesn't have its own lane to turn left or an arrow to turn left, and then sometimes that left lane gets all clogged up, and that's one of the things that just drives me bonkers. In the terms of healthcare and the medical profession, what's something that when you walk through clinics or hospitals all over, you see a layout, signage, something that just every time you see it, you know it's wrong and it drives you bananas?
I think the worst part of doing a Master of Design is my whole life has become that. So I find problems everywhere. What I look at actually when I'm walking through spaces and places is sometimes how we've built things around access and flow and getting a number of people through. And when you look around is, you know, can we make more compelling spaces that are healing environments? And when we see bottlenecks and people pooling in different places, you wonder, you know, can we do this differently? And I would say clinics and patient experience in clinics, we do a lot of work in terms of helping people find their way to spaces in hospitals when I don't think people actually want to be in the hospital. And so is there ways that we can look at virtual models to move things forwards? Those are the kinds of things I think about. It's really walking around the environment every day. You can see it.
And briefly, what's just the coolest thing you've ever seen in a physical space?
The coolest thing I've ever seen is actually that MRI machine that I think GE or Philips did, where they recreated the experience so that kids actually want to go in the MRI machine.
Like a little playroom.
Yeah, and so you've got this multi-million-dollar technology that really it was the experience that's transformed that.
Very good.
That's just, to me, a small example of the power of design.
Thank you so much. Sean Molloy, everybody. Thank you.